Dr. Kendall here. I have an awesome patient who is upgrading from big pieces of plastic to implants, but I wanted to use this as an opportunity to, if you have dentures out there, I just want to talk about it. Even though I don't like dentures, I don't like, I call them big pieces of plastic. I actually know a lot about them. So if your denture's not fitting well, I wanted to give you a couple of tips on things that you should look for. So our patient here had a bunch of reline material because this set never actually fit her mouth properly. It rocks. I'm guessing it was what we call an immediate denture, which means the teeth were taken out and this was put right in. You know, a lot of times when you have an immediate denture, teeth are taken out immediately, dentures put in. That's kind of a guess of where the denture is going to be, what the bone's going to look like, the tissue is going to look like, so you don't really know. So a lot of times people will get a soft liner. We cut a lot of that away, made a mess on our floor, but we cut a lot of that away because it was not sitting properly. But that's kind of the only option she's had because this hard material, the acrylic, is not in the right place. But a couple things, let's go ahead and go into Andrea's mouth here. She's excited to get teeth that don't fall in and out, right?
Yes.
Okay. So, but when you put a denture in, so I'm just going to show this on the top, okay? The denture is supported by tissue, and what you'd want to see is when I push up here, that it would be firm and supported by tissue, but we can see hers is all over the place. So there's no way a denture is ever going to be stable if it moves around like that. The other thing we want to look at is when you put a denture in, if you pull down on the lips, okay, and it dislodges like that, that tells me that these flanges on the side, they're too high up. And if we look in here, let's see if we can look. Let me put the light on. This reflection of tissue here, any kind of movement on that, especially this frenum here, any kind of movement is going to dislodge that. So what you'd want to do is you'd actually want to cut away a lot of this so that when you pull down on it, it doesn't dislodge the denture. None of that's going to work with this because it doesn't actually fit her gums. So that's one of the things to think about is you don't want your flanges to be overextended so that any of the tissue is going to move that. Now the bottom is very difficult because the tongue and the cheeks and everything are moving that device around. That's why people absolutely hate their bottom dentures, because when we put these bottom dentures in, I call them big pieces of plastic. Okay. When I put this in, we can see how when I move the tissue around, go ahead and stick your tongue out. Okay. It's not moving too much with the tongue movement, but we can see here it's overextended because you can just see those teeth moving all over. So same thing, if we look at her tissue here, based on where that reflects and where it comes up, the teeth themselves, the flanges, they have to be cut down so that that's not going to impede. So just a little information, if you're going to have big pieces of plastic, they've got to fit well. They've got to be supported by the tissue because these are tissue supported devices. And that's why they suck so bad because, you know, the gums and everything is moving. It's just you have to glue them in place. They're not teeth. They're big pieces of plastic. Is that what they feel like to you?
Absolutely.
So you've had these for how many years?
4.
4 years. Do they feel like big pieces of plastic?
Yeah.
Not fun, right?
No, not at all.